So there should be support groups that will empower the young girls so that they can know about this dysmenorrhea and they can shape themselves according to that.
Empowering young girls and educating them about it and telling them about it, that of course there is certain limits. You should not hide it. If you are having any abnormal pain or severe pain, you should not hide it.
Myths have been here since centuries. It's now high time that we debunk those and make the path for evidence-based therapies and evidence-based approaches to actually help women.
From playground whispers to lifelong health decisions, misconceptions about period pain start young. Let's break the cycle with expert insights. How myths shape early perceptions of menstrual health.
Myths shape early perception by basically you can say that if they have these symptoms, they can early report to their parents, their mother, so that these myths will be reduced.
Definitely, there are several myths which goes around about menstrual cycle. That some people say it is a dirty thing, or you are. Some people do not bath during those days. That is a very and that is also very common. The girls do not take bath. Obviously, in the initial days, you are uncomfortable to take bath, but if you the hygiene is not proper. Some of the people don't use any proper clean sanitary pads. That should also be used. That is also very important. You should use it, and there is no need to hide if the child is having pain or severe pain. So that if there is any cause, it should get treated properly. And lastly, what I want to say that all the girls should have an education that this is a normal thing, and that will occur in certain age, in 10 to 14 years. So if you are not going to tell your child that this can happen, in the 13-14 years it will suddenly start, and then that is sometimes really shocking for the young girls. That what is it? Even the girls are shocked. There is so much bleeding in it. So I think this is the time we should educate our girls beforehand that this is a normal thing, and it should start at the age of 10 to 13 years. It is a norm, and how to manage themselves during those days, and if they are having pain, and if they are having any unusual thing, then they should, for example, during the cycle, after 21 days there is a bleeding, but if there is an intermittent bleeding, or sometimes in the middle of the cycle there is bleeding, it should also get investigated. So all these things, I think we should have a proper education about the menstrual cycle and menstrual hygiene, and before it should be done in the school going age.
Myths have been here since centuries. It's now high time that we debunk those and make the path for evidence-based therapies and evidence-based approaches to actually help women.
Empowering young girls to make informed health decisions.
So there should be support groups that will empower the young girls so that they can know about this dysmenorrhea and they can shape themselves according to that.
Empowering young girls and educating them about it, and telling them about it, that of course there is certain limits. You should not hide it. If you are having any abnormal pain or severe pain, you should not hide it. You should tell to your caregivers. You should ask your parents to take to your doctor. Even you can ask your parents also. So if there is severe pain or severe dysmenorrhea, it can get treated, and everything can be tackled if properly treated in time. Then maybe if there is cause, it can get properly treated.
We need to inculcate individualism in everyone, especially women, because of that happening is we are not making them independent. We are not making them think of their own. We are following a path, and we forced our girls to follow that path as well. So it's important to help them make their own choices, make their own decisions based on all of the information given, because it's the modern time. We need to inculcate those.
Every girl deserves accurate information and the confidence to make informed health choices. Let's build a future free from menstrual myths.